Hello and welcome to North Country Matters. My name is Donna Seymour. I'm a member of the St. Lawrence County League of Women Voters, one of the civic partners for our show. Today, my guest is Cynthia Ayer, who is the Medicaid counselor with the St. Lawrence County Office of the Aging. Cindy, welcome to North Country Matters. You've been presenting Medicare 101 programs around the county now for months, trying to meet the needs of the county's seniors who are either becoming eligible for Medicare as they turn 65 and educating them about their options during the Medicare Open Enrollment period from October 15th to December 7th, which is going on right now. So this is a really critical time to help seniors understand what their options are, isn't it?
Yes, it is. It's a very important time for a lot of people.
So, Cindy, tell us a little bit about how you got involved with the Office of the Aging and how you became the Medicare guru in the office, because I know there's training that you have to go through in order to do this.
Yeah, so I used to work at the local Department of Social Services in the Medicaid unit. And then I came over to the Office for the Aging and I actually thought, well, I'm going to get away from insurance for a while. But because I knew a lot about how insurances worked, having worked in the Medicaid unit, Nancy Green, who had been in this position, had me helping her a lot. And when she got ready to retire, they offered me this position. So I am still doing insurance.
Yes, actually,
I
my
do
husband,
go,
well, go ahead. I'm sorry.
no, that's okay. I go to a conference once a year for all the insurance counselors. They're called high cap counselors in New York State, and we learn new information, and we do have to take a test each year.
My husband and I met with Nancy when he was getting ready to turn 65 to get an understanding of what the process was. But of course, meeting with people one-on-one is not the most efficient use of anyone's time in the office, is it?
No, it is, people enjoy meeting one-on-one, and I do try to fit everybody in that wants that appointment. But because there are so many seniors in St. Lawrence County, and I am the only one doing this, I do have to try to do some of it over the phone. And that was what I was hoping with the Medicare 101 presentations, is to meet with larger groups at one time.
Well, it certainly seems to be working. So Medicare is an absolutely vital program to America's seniors and the disabled. 67 million older adults and people with disabilities rely on Medicare as their primary health insurance. And 81% of Americans have a very positive view of traditional Medicare. So let's talk numbers a little bit to start with, Cindy. We know the so-called baby boomers have been coming of age into the Medicare program for some time now. How many seniors, 65 and older, are there in St. Lawrence County, and how many become newly eligible each year on average?
So statistics this year was about 26,000 seniors in St. Lawrence County, and for 2025 they're estimating about 28,000, so another 2,000 at least turning 65. But overall, throughout the whole country, they're estimating about 10,000 people turn 65 each day, and that will continue until 2030.
Wow, that is a lot of people who need to be educated about their choices. And there is a lot to consider when it comes to Medicare, isn't there? What are some of the basics you start with when you're talking to seniors about their health care?
So when somebody is just going to be turning 65, I do explain how Medicare works, what parts of it are from the government and what is a personal choice. And then there's a lot of people that they had turned 65 maybe 10 years ago, but they still never fully understood how it works. And now with so many different options, they want to understand more.
Okay, so there's Medicare Part A, B, and D that are sort of for everybody that they need to understand what those pieces are. Can you briefly describe each one of those for us?
Yep. So the government only provides two of those. They provide Medicare A and Medicare B. Everything else that people have is a personal choice and a private insurance company. But the government wants you to have at least Medicare D, which would be for your prescriptions. So I can go over the Medicare A and B, what they cover if you want.
Well, just in general, the Medicare Part A is hospitalization coverage if you actually end up in the
Yes,
hospital, and Medicare B is all the other ancillary services like going to the doctor or, maybe physical therapy or something like that, correct?
correct. Part B is anything when you're not admitted to the hospital.
Okay. So many people decide to switch from original Medicare to a supplement plan, which covers the so-called Medigap, uh, which is all the services like drugs that aren't covered in Medicare. And so if they don't have private insurance, which many people end up with after they retire, it's part of their retirement benefits. But if you didn't work for a company that had that, you're on your own to find out what's out there. So can you explain the difference between the supplement plan and a Medicaid Advantage plan so that people understand the
Yes.
differences?
Yep. So you basically have two options if you want to add extra coverage. So you would still have Medicare A and B, whichever way you decide to go, but you could have Medicare A and B, and you could add just a standalone prescription plan. That would be everything that the government wants you to have. If you don't sign up for a Medicare D plan when you're eligible, and then you want one a few years later, you can be penalized each month for the cost of it. And that penalty goes forever. So you would always be paying more for your drug plan. So that's why I recommend getting at least the drug plan. Then you can add a Medigap or a supplement plan. And that would be, you would be paying a higher premium each month. But then most of the costs that Medicare doesn't cover would be picked up by that plan. So that's a more expensive way to go. It does give you some really good coverage. The other option is to go with an Advantage plan. With an Advantage plan, you still have Medicare A and B, but everything gets billed to your private insurance company Advantage plan. The government gives the Advantage plan money for each person on the plan, and then that plan takes on your medical. With an Advantage plan, you would still have everything covered that Medicare covers, but at different costs. With an Advantage plan, you don't pay anything or very little upfront to have the plan, but you pay as you use it. You do also have to stay within a network of doctors, and there would be prior authorization for tests and procedures.
So it's important to choose a plan that really meets your medical needs. And as you say, if you were on Medicare 10 years ago and didn't choose a drug plan then, you're going to be paying for that now because it was not something that you understood you should have done up front. So that's one of the reasons why I think the Medicare 101 things that you're doing out in the community are so important because it gives people that information they need to make good decisions, doesn't it?
Yes. And there are people with a lot of questions out there.
I'll bet. So how can people find out more and compare their options between the various plans? Because they offer quite a wide range of services, and you really need to understand what you want and what you need before you make a choice, don't you?
Yes. So a Medigap or a supplement plan can average about $250 a month on top of your Medicare B premium, which this year was $174.70. So that is very expensive, but it also, you would want to think about what you'd been paying out maybe in the past year for medical. So if you'd had an Advantage plan last year and you had been paying out a lot in medical bills, that might be a time to think about switching. If you've had an Advantage plan and it worked well for you last year, then chances are it's going to continue to work well for you as long as your doctors are in network. Some of the Advantage plans this year have ended, so they won't be an option for 2025. So that's caused a lot of stress. So that's when people can talk to their doctors, find out which plans they participate with, and then that will give them a better idea which plan might be best for them.
Yes, I know the United Healthcare plan just ended for people up here in the North Country. So we have friends who were using that, and now they're in that position of having to find a different plan. And I think it would also be useful to let people know that their Medicare premium actually comes out of their Social Security. So it's not like they have to pay out of pocket for that. It's actually deducted from their Social Security check, correct?
Yes, that is correct.
So that's one you get a little bit less in your check from Social Security, but it's one check you don't have to write every month out of your pocket. So that's good. So New Yorkers also have additional health coverage options in EPIC, which is the Elderly State Pharmaceutical Insurance Coverage. Tell us a little bit more about that too, because that's really for low income folks, isn't it?
Well, it is higher income people can have EPIC. So if you're single and you made 75,000 or less last year, then you would qualify for EPIC, or 100,000 for a couple. What EPIC does is, based on your income, would assign you a deductible, and then you would have to meet your Medicare D plan deductible, then your EPIC deductible, and then the EPIC would kick in and could lower the cost of your prescriptions at that point.
So that could be very helpful if you're a person with high cost prescriptions and taking a lot of medications, right?
Yes, it's always good to look at it and see if it can help you.
Okay, good. So in the news just this week was information on the New York State Medicare Savings Program. Let's talk a little bit about that, because a lot of people, that may be new information for them. They haven't heard about that before.
Yes, so the Medicare Savings Plan, they've been around, that program has been around for a long time, but in 2023, they changed it quite a bit. They raised the guidelines quite a bit so that a lot more people could be eligible. So I am still helping people get that, where they may have looked at it before 2023 and didn't think they were eligible and didn't know they needed to look at it again. So that I've been helping a lot of people with that. The Medicare Savings Plan has 2 levels. One level pays your Medicare premium and the copays and deductibles for anything covered by Medicare. So that is a great option. The next level up, with a little higher income, pays your Medicare premium. So you get that $470 back in your check each month, which is a big savings. And then either one of those programs also puts you on the low income subsidy, or the extra help for prescription costs. So then this year, the most you would pay for a prescription is $11.20, which can be a huge savings, because sometimes they're over $100 each.
Oh, yes, that's for sure. Anybody that's ever had to go to the pharmacy, and when the pharmacist says, "You do know how much this is going to cost, don't you?" It always says, "Uh-oh." So, and the number to call for that program is 1-800-701-0501, and I'll be sure to put that in our show notes so that you don't have to memorize that number. So let's switch
And
now. Oh, excuse me. Go ahead.
Can I just say one more thing? They can call our office, and we do have the applications here, and we can help them with the application if they need help.
That's good. You know,
that's the Office for the Aging.
That reminds me, Cindy, that just about every county in New York State does have an Office of the Aging. And do most of those offices have someone like you, a Medicare consultant, who can help folks with these problems?
Yes, every county has a HICAP counselor like myself. They don't always work at the Office for the Aging, but they would be at some agency within the county.
Okay, so it would be somebody, they would know who to get a hold of. So this isn't just information that is specific to our county at all. This is for anybody in New York State. So that's good to know.
That's correct.
Yeah. So the Medicare Open Enrollment period is from October 15th to December 7th, as we said. So what can seniors on Medicare do during this time frame each year?
So they need to look at their costs for the past year and decide if that had worked for them. If they were struggling financially because of their medical costs, that would be a time to look at your plan. And there's not always another option, but at least they would know why they're paying out that much and what they could do to possibly change that. They also need to look at any information they get from their current plan. Their current plan will send any changes to them. And that's important to look at, because, like, as you said, there are a number of Advantage plans that are ending at the end of this year, and they would need to pick a new one for 2025.
Right. So that's if you get a letter from your plan, open it right away. Don't think it's junk mail, right? So that's important.
That's correct.
Yeah. So if someone's health has had a major change, that would be another reason to maybe look at it for a different plan. For example, if your health has worsened and you're having a lot more hospitalizations or doctor visits, and the plan you're on really isn't meeting your needs, that'd be another reason to think about looking, wouldn't it?
Yes. Now be a great time to give me a call. I can kind of help you look at it. And
Mhm.
that goes for the whole year. If in the middle of the year you're having problems with your medical bills, that's a great time to give me a call. I can't always change that for you, but there are options, and sometimes I can help people with that.
And that may be where getting involved in Epic or the savings plan would be useful for someone too, right? Even if they didn't start right in January, switching might be useful for them to get it on Epic, correct?
Yes, the Medicare Savings Plan and Epic you can apply for any time of the
Okay,
year.
that's good information. Thank you. So, talk to us a little bit, Cindy, about how folks can learn more about not only the services that you provide through the Office of the Aging, but the Office of the Aging services for seniors in general, because you your office does a tremendous amount of education and referrals and uh, have a lot of resources at your fingertips, don't you?
Yes, so we do have a newsletter each month. A new newsletter comes out. We do print some of those. We have copies here. We have copies at our meal sites,
Mhm.
and you can also receive the newsletter via email. It's on our Facebook page, the newsletter is, but also we have our Facebook page that we put articles or upcoming events on. That's always helpful. We do try to advertise any upcoming events on North Country Now and other news outlets. You can come stop by our office. We have pamphlets that explain our programs. Or
Yeah,
give us a
I think
call.
the resources that you have and the way you do outreach is just so effective for the seniors in this county. So, do you have upcoming Medicare 101 presentations where you'll actually be in person in front of groups coming up?
So I don't have any more coming up right now during open enrollment. I just finished, I think, my 8th one last night at Brazier Falls Library.
Mhm.
So I am very busy right now, but I will plan some more in the spring. And then next year before open enrollment, I will have more.
So, if someone has a question now, they'll have to kind of get a hold of you personally in the office as opposed to being able to go to one of your presentations. And I know those presentations have been well attended, and lots of people have lots of questions. And so it's a great venue to because when you listen to someone else's question, it may actually spark a piece of information that you needed to know and didn't know you needed, right?
Yes, and that's been a great thing by doing these
So,
Medicare presentations.
So as we wrap up, Cindy, do you have any final thoughts you'd like to share with seniors about Medicare and about what they can do for themselves to help themselves through this federal insurance program?
The main thing is to understand what coverage you have, maybe understand why you picked that coverage, and just go with that, what you decided, and don't let somebody persuade you to get something else unless you are doing the research and know that it's an educated decision that you're changing plans. People get a lot of mailings and a lot of phone calls trying to get them to switch, but there is no like great plan that's better than all the others. They all work similar depending on if you have a Medigap or supplement plan or an Advantage plan. So by switching, you need to make sure that you're making an educated decision and that you're not going to have an issue with seeing your doctor that you've been seeing or ending up with a lot of medical bills later.
Thank you. That is great advice. And I really appreciate the time that you've taken to come in and do the show with us today. And if you've been doing 8 presentations around the county, you have been out there. Your face is well known in the senior community, and people do know that they have an expert they can go to for help. So On behalf of all of us, thank you so much for the work you're doing.
You're welcome.
All right. Well, thanks for coming in today. So I want to remind viewers that Medicare is a federal program that was signed into law in 1965 as part of President Johnson's War on Poverty, which he spearheaded in the mid-60s to address senior poverty, which was endemic at that time, largely many times caused by high medical, which is still true today since medical costs have done anything but go down. It was a companion to Medicaid, which was to provide health care access to the poor, and to Head Start to provide access to critical early education childhood and to support families in need. 2024 is a federal election year with the presidency as well as 1/3 of the Senate and the entire House of Representatives up for election. Before you go to the polls, make sure you know where the candidates that you will be voting on stand on these critical anti-poverty programs, because they will make a difference in your life. These conversations are a production of North Country Matters. This show is a civic collaboration between the League of Women Voters of St. Lawrence County and the Potsdam Public Library. Until next time, remember, our North Country matters.